This is Krista Michener. Welcome back to Made to Be Whole. Today we're going to talk about the power of nevertheless. Stay tuned.
Made to Be Whole is intended for informational purposes only. It's not intended to replace the advice or care of a licensed healthcare professional. Participating in this podcast does not constitute a provider-patient relationship with Krista Michener, AHP Integrative Health, or any of the guests featured on Made to Be Whole. Krista Michener, AHP Integrative Health, and any featured guests aren't responsible for any losses, damages, or liabilities that may arise from use of information obtained in this podcast or associated materials. Please consult a healthcare professional for any health-related concerns that you are experiencing.
Hi, welcome back to Made to Be Whole. Today we're going to talk about the word and the concept of nevertheless, and I will divulge where this came from and where I'm going for this. It seems like we have frequently two mindsets. We have people who complain about everything, and you may be one, but if not, I'm sure you know one. And then we have people who are a little overly Pollyannish, who just want to point out how everything's really a blessing and you're really blessed and you shouldn't complain about anything. And that's not really healthy either. Some people might call that the power of positive thinking, but that can be a little toxic and stifling and not quite honest. I was talking to my kids recently. I've been reading in scripture, and this word nevertheless came up 3 different times, and it was all records from 3 members of one family. So it is in the first 2 books, actually, of the Book of Mormon, and the very first verse introduces this concept, which I think is fascinating. So it talks about how Nephi had seen many afflictions in the course of his days. Nevertheless, having been highly favored of the Lord in all my days, having a great knowledge of the goodness and mysteries of God. So he doesn't mince words that he had seen a lot of afflictions, and they had been driven out. There had been starvation. His brothers tried to kill him. There was a lot of persecution. It kind of sucked, and he acknowledges that. Nevertheless, he had seen the Lord's hand in his life, and there had been a lot of good things. And then we see his father talking to his younger brother, Jacob. This is as his father's on his deathbed, and he's talking to him, and it says, "Behold, in thy childhood thou hast suffered afflictions and much sorrow because of the rudeness of thy brethren. Nevertheless, thou knowest the greatness of God, and he shall consecrate thine afflictions for thy gain." And then that Jacob, when he gets older, is teaching. He uses that same phrase, nevertheless. He says, let's not hang down our heads. We've been through a lot. Nevertheless, we've been driven out of our land of our inheritance, but have been led to a better land. So what does that have to do with health? I really, really feel like my patients who do the best, and I've felt more peace in my life when you're able to hold space for both of these things. That it is true that mortality, but let's talk illness in the context of chronic illness or chronic infection, since I work a lot with that. There's some really, really hard things. There's some really challenging things. In relationships, there are challenges. I don't think that most people have never had a challenging day with their child or their spouse or their parent. And I think pretending that those challenges aren't there isn't healthy, because it doesn't allow room for correction, grief, growth. But when you will only sit in those dark places, you're stagnant. And so you can, and I know some people like this who they define themselves by their illness. That has become their identity. And I know it's a challenge when you're in maybe a phase where every day is affected by health challenges, where you may have lost the ability to work. You may have lost or have impacted some important relationships. I'm not trying to sugarcoat the fact that this can be really, really difficult. But even in these extremities, that's not all that you are. You're more than your illness, you're more than your limitations, and you frequently have more to give than you think you do. It just might have to be redefined. You might have to reshape things. On the other side of things, we were having an extended family conversation about a challenging situation, and some of us tend to deal with those things by making jokes, teasing, and then we got a well-intentioned talking to from one family member about how it's just a blessing. It's a blessing to be able to help. It's a blessing, blessing, blessing. And that's nice, but the situation was still hard. And you really, I don't think, are doing anyone a service if you can't acknowledge, yeah, this is really hard. This is difficult, nevertheless. So how do you do that in your daily life? I'm going to give you a few examples of how I've tried to embrace that more recently. So yesterday was actually an excellent example. I had last week a couple of really, really good days where not only was able to work, come home, make dinner, but like get a lot of work done around the house at night, work until 8 or 9 at night, which for a lot of years wouldn't have been possible. It was really exciting. But then the last few nights, I've gone back to the cycle where I get to a certain point and it's just really hard for my body to be upright. It's not like I need to lie down and sleep, but I just can't be upright anymore and I have to lie down. So yesterday I went to work, I made dinner, and I helped my kids with a few things with school, and I said I have to go lie down, and I was kind of depressed about it. I had been feeling some anxiety, and I talked it through, and then I laid there and I started to think of all the things that had gone right that day. So it's very true that I wish last night I hadn't gone and lied down at like 6:30 for an hour and a half. I would have rather been up and doing things. But when I laid there, I thought, what was I able to do today? Things that for a long time would have been difficult. I was able to get up at 6. I was able to do my physical and spiritual health routine where I did my sauna, my yoga, my treadmill, reading my scriptures. I was able to work a full day. I was able to go to the grocery store. I was able to come home and make dinner for my family. 4 of my kids were there. Not only did they not complain about dinner, they thanked me. I was able to help them with their schoolwork, and I had a comfortable place to lie and rest. So it was disappointing that I had that surge of anxiety and that I had that physical weakness for a few days come back, but that doesn't take away all of the good. So try in your daily life, but also in the bigger perspective, to keep track of both sides of things and to find ways that you can be honest about both. Some people are toxically negative and some people are toxically positive, and both are kind of nauseating, honestly. So one way that you can mitigate that, besides trying to find the people in your life that you can be honest with and be real, I think that keeping records is really, really important. I encourage patients to track their symptoms. I understand the hesitancy from some people because, first of all, sometimes you're tired and it's one more thing. And some people have said to me, and I get it, they're like, I don't want to be thinking about everything that's going wrong all the time. I don't want to give any more attention to this. I just want to live my life. But by taking time to keep records, and they can be brief ones, we're able to see patterns in our lives and discern truth a little more clearly. So the type of symptom tracking that I find effective, and you can apply this to a health journey or really to any goal that you have. I say, hey, even if you're techie and you're younger, you can get an app or you can do notes on your phone. But if you're not, get a cheap calendar from the dollar store, one of the free calendars they give out. Every day, make a few basic notes. Like if your top symptoms are fatigue and headache, rate those every day out of 10. Make a space to write down anything that was different. Started a new med or supplement, started exercising, didn't sleep well. And then I would add to that, write down something that went right that day. And it can be a couple of words. It doesn't have to be a discourse if you're using a calendar, obviously. But then you can go back every week and every month, and you can see patterns that help you figure out, first of all, what's going right. Because a lot of times changes are very subtle. I will have people say, oh, nothing's changed, everything's the same. But then when we go back and look, well, your headaches were always an 8 out of 10. And for the last month, they've been a 5. So you're still having headaches. And we want to get that still improved. But that is progress. Now, if they were still an 8 and still daily, then we would know it's time to change course. Let's try something different. What we're doing isn't working. If something gets worse, if you're keeping a record, then instead of just feeling like, oh my gosh, this is terrible, something's getting worse, when's this ever going to end? I mean, have that boohoo moment, but then go look, did something change? Did you start or stop taking something? Did your sleep get worse? What different was going on? Be a scientist and collect data in your own life. This is going to help you make progress. And then also have some functional goals, not just, I want to feel great all the time, because guess what? Even if you don't have Lyme disease or Bartonella or whatever is ailing you, the rest of the world doesn't have all perfect days. Nobody does. But what are your functional goals? What is it that you would like to accomplish? And then measure your progress toward that. So there's my little nevertheless. Now you've got your micro nevertheless. So like I experienced yesterday, and your macro nevertheless. So looking back at the bigger picture, Tanya Runez, I think is her name, and I'll post a link in the notes, gave a talk at a church meeting a couple years ago called the overview effect. And the overview effect is something that was first described by the people who first went to the space. I think it was the people who first went to the moon, because you saw Earth get smaller and smaller and smaller, and it just completely changed their perspective. Things that seemed overwhelming seemed much more manageable. And she talked in her message about how we really need to strive to have that overview effect in our relationships. When you have children, you can hyper focus on what's going wrong, or your worries, or the things you think are bad that are happening or that you want to fix. But that can cause a real strain on relationships. And so she gave some really, I thought, beautiful advice about the ability to step back and see things from a bigger perspective, how big of a deal this is in the long run, and remembering that life is a journey for us, for our children, for those that we're helping, and what we're looking at that means seem horrific in the moment is just a piece of that journey. So, some of the macro neverthelesses, I would say, in my life, and I'll speak again from the context of the chronic infections that I've dealt with my family. I mean, it's really been difficult not only to be ill, but to have children who are sick, to have your finances. I just told my friend who's helping me record, my income is my outcome. You make money and it goes right back to labs, supplements, treatments, whatever. Nevertheless, from those challenges, I've found a career path that's much more rewarding because I've been able to help people in a deeply personal way and relate to them in ways I would not be able to otherwise. I've been driven to seek further education and training on my own that's led me to meet some amazing people and learn about the body and the world in ways I would have never been challenged or had the opportunity to otherwise. My children are 5 out of 6 are technically adults, and most of them are at or near home and have their lives haven't taken off kind of how they expected or how my husband and I thought they might. And that's been hard. I mean, that's been a grieving process for some of them, looking and saying, quote unquote, everyone else my age is doing XYZ, which isn't true, of course. Everyone else isn't off on their own, independent, without challenges, and allowing them to mourn that and grieve that loss. But then the things that they have gained, the compassion that they've gained for others, and the wisdom that they've acquired and the faith that they've developed aren't things that they would have if they had had a carefree adolescence and young adulthood. And even though I grieve for those losses, I'm so impressed by what they've taken from it and what they've become. And I truly believe it's going to help them do life better. I think it already is, but as far as choosing meaningful careers and meaningful relationships, there was an interesting program I was watching. It's called Come Follow Up. And the guest this last week, or 2 weeks ago, his name was Sam. And sorry, Sam, I don't remember your last name. But he had lost both of his arms working on the electrical lines, which obviously, being a double amputee, causes a lot of challenges as far as your physical abilities, relationships, pain. That's a huge loss for any person, but especially a young man who's kind of the prime of life. But it was interesting as he worked through all of that and grieved. He said he really came to believe that this had been part of the plan for his life all along, and has learned to embrace these differences and use it and find ways to help other people. One of the things that I see that's challenged me in the past, that I feel like I've been blessed to mostly move on from, and I see really challenge others, is we want so desperately to be understood and accepted, but sometimes we are looking for love in all the wrong places. You're not going to get everyone's acceptance, and some people's acceptance isn't freaking worth it. Like, just move on, look for a new tribe. And if you want to know where to look for that tribe, I suggest starting with looking for people who you can help. You may feel very, very limited, but when my children were young and highly dysregulated and our life was chaotic, and not everyone liked to be around us, and we didn't get invited lots of places, but I found that when I would do things like offer a ride to church to someone who didn't have transportation, or people who were alone, who were utterly alone, they were actually delighted to be around my dysfunctional family and were so grateful. And it really helped me to see and focus on what I had, instead of the fact that my kids didn't fit in with other kids, because they didn't. And you know what? It's okay. Fitting in isn't all it's cracked up to be. So finding people who need you, and it doesn't have to be in big ways, and it doesn't have to be in ways that make a good social media post, because those are generally a little less meaningful. There are people everywhere who could use something that you have to give, and you will find more meaning and satisfaction in your life as you look for those people. There is a favorite line in scripture that I have. It talks about how when Joseph Smith was murdered, they said, when they were kind of eulogizing him, he lived great and he died great in the eyes of God and in the eyes of his people. And I thought, that's the way to go. He didn't live great and die great in everyone's eyes. There are a lot of people that hated him. They killed him. They killed his brother. His family was persecuted and tormented. And there were a lot of things that really sucked. But his life was good with God and good with his people. So find your people, and it doesn't have to be a lot of them. We only need a few people who are sincere, and they don't have to get everything about us, because that's a rare treasure. It's nice to find those people, but who you can live with integrity around. People that it's okay to say, oh, this was a hard day, but also acknowledge the good things and bring out the good in you. A last little quote here, and then I'm going to transition. I was listening again to this Come Follow Up program, and the guest this week, Maite is her name, but she said, and I got off the treadmill, I was on the treadmill listening and ran to write it down because I thought it was so beautiful. She said, I hit rock bottom, but it was during those times that I learned that the rock at the bottom was Jesus Christ. And I thought that was so beautiful. And we all are going to hit rock bottom at points in our life, but that doesn't have to be the end. That can become a foundation on which to build. And I just encourage, if you're at that place, to look for light, to hold on to the things that you do know and the love that you have felt, and to rebuild and build your life on a sure foundation on true principles, on relationships that matter, and to not be afraid to leave relationships behind that don't build you up and don't encourage you. You are not going to please everyone, and that's okay. So that's my philosophical waxings for the week. But then I also wanted to say a little bit about treatment goals. I've realized one of the questions I get a lot when people come in for treatment about anything is, how long is this going to take? They want a timeline. How long is this going to take? And that's a really difficult question to answer because every individual is so different. Every journey is so different. Part of it depends on how long you've been sick. If you've been sick for a couple of months, that's different than someone who's been sick for a couple of years and someone who's been sick for a couple of decades. And where I see people fail is when they have a very fixed idea of what it means to be better and how they're going to get there. And we've touched on this before, but I think this can impact what we were talking about with the neverthelesses. I've talked about how I have people who they just want brief treatments that are covered by insurance, and it's going to just be done. It's just going to be done, and it's not going to take change of lifestyle, financial sacrifice, those sorts of things, and that would be great. I haven't found that works for most people. I have people who would rather die than take a prescription, which I think is a little extreme also. I think we really have to look at what's available to us. So, what determines how quickly someone will get well? Part of it is open-mindedness, how long it takes you how open you are to trying different things. Part of it's luck. Some people have bad luck. And if we dig deeper, that can be bad genes and some of the other things we've talked about. But part of it is this perspective. So I take healing and I've decided to put it into 3 categories because I really do have 3 treatment goals for all of my patients and for myself and for my kids. And I think if you're willing to have that overview effect and be keeping your eye on all 3 categories, you're going to have the best success. So number 1 and most important is just that you feel better. So that's the main treatment goal, that you feel better, that you function better, that your quality of life is better, that your symptoms are relieved, all of those sorts of things. That's category number 1. But you can achieve that and still have problems down the road. That's why I have my category 2 and 3. So number 1, feel better quality of life. Number 2, normalize labs to the extent that we can. So, some labs will never be normalized. If you have factor V Leiden, which is a genetic clotting issue, you're always going to test positive for that because that's a genetic issue. But what labs can we normalize? We can do a lot with nutrient labs. We can correct hormones. Even in the context of vector-borne infections, there's so much more hope and so much better science than there used to be. I talk a lot about T-Lab because I love it, because you have an actual image of your blood cells where we're looking for the actual genetic evidence of the infection, and we know that we can treat to negative labs. That's huge. That is absolutely huge because that gives us so much more confidence that as we withdraw treatment that you're going to stay well. And the reason that matters to me, because some people might say, well, who cares? Who cares if I have category 1, if I'm feeling better? Who cares what the labs say? Fair question, but it's because my 3rd area or marker is I want to prevent future complications. That's the big thing. It's not because I want to pat myself on the back and hang things on the wall and say, look, I helped these people get normal labs. It's because I want to do everything I can to minimize the risk of dementia, to minimize the risk of chronic pain, to minimize the risk of long-term neurological problems, especially neurodegenerative diseases. In the context, again, of vector-borne infections, with 2 exceptions, everyone who's walked in the store with ALS, Parkinson's, MS, dementia has tested positive for some of these infections. And I'm not claiming that those are the cause of all neurodegenerative diseases, but I am saying that they're a risk factor. If you have a vulnerability for that and you have an infection that affects blood flow, that you can have biofilms and plaques and fibrin deposits that affect brain function, then you are much more likely down the road to become vulnerable to one of these chronic, debilitating, heartbreaking presentations. So you may say, you know what, I just don't care. I'm just going for feeling better and that's all I want. That's completely up to you. That's in your court. But my ultimate goal is for you to be well and to stay well. And so that's why I encourage people to stick with it. It could be that you're treated for 6 months and you're doing great. For a lot of people, it's longer than that. And if I had a fast, easy way to do this, I 100% would. It is not my goal for people to be my patients for a long, long time because they're still sick and they're not where they want to be. But it's my goal for you to get better and stay better and live the life you want, not only now, but in the long term. So as you're going through your health journey, whatever it is, if it's emotional health, mental health, physical health, if it's these infections or something very different, keep in mind that you need to look at the big picture, that you're going to have the best outcomes and it's going to be the best investment of your time, money, and effort if you can not only improve how you're feeling now, but you can normalize labs and physiological function to the extent possible so that you can live your best future life, because it is a lot easier. It is so much easier to prevent than to repair. Sometimes you come and you're in the condition, you're Humpty Dumpty and you've been pushed off the wall and we're putting Humpty Dumpty back together again. And that's possible, but it's a lot easier to keep Humpty Dumpty off the wall and to prevent that shattering and to be able to avoid all the pain that goes with rebuilding. I would encourage you, and I would love to hear if it's by phone message, by email, comments. We'd love to hear the neverthelesses in your life. What have you gained from the health challenges that you've endured? How have they made you better or broadened your perspective? Who have been the helpers in your life, and who have you been able to help because of what you are living and overcoming? So remember to have hope, because you were made to be whole.
Thank you for spending time with me today. If you like what you hear, please subscribe to be notified when new episodes release. And remember, you were made to be whole. Have a podcast question or suggestion? Text or call us on the podcast info line at 330-439-0686.